development, global health. Sema Sgaier is here with me today, someone I've known for many years. Love to talk to you, Sema, because you've got a unique perspective on how development and global health work ought to be done in general, and a particularly unique one now in this moment of the COVID-19 response. In fact, you lead an organization called the Surgo Foundation. You're really pivoting that organization to focus on these issues of the COVID response. So I want to get into all of that, but maybe before we do, you're a neuroscientist. Your team over there includes lots of neuroscientists and data scientists and others. You really focus on behavioral science. You used to be at the Gates Foundation, leading some global health work. Love to hear just your overall take, given your background. I think you've got a PhD in genetics and molecular biology. How do you see the pandemic? How do you see COVID-19 today in terms of how it's unfolding around the world? Love to just get that general take, and then we want to dive into what Surgo Foundation is doing.
Mm-hmm. Great, thanks, Raj. It's wonderful to be here with the Devex community and wonderful to be back conversing with you. So in regards to COVID, I think all of us are being affected by COVID, whether we live in Washington, D.C., India, South Africa, Madagascar, wherever it may be, we're all being affected. From our perspective, what's really critical about COVID is how can you address this pandemic using precision and really understanding the underlying human behaviors as well, right? So we know that resources are limited. The countries who are able to address the pandemic in a way that worked actually took great precision, acted really early, and used a lot of data to do this well, right? South Korea being a good example. I think many of us are too late in our response and therefore had to take pretty broad measures in terms of social distancing everyone for a very, very long period of time, which is fantastic. It's working actually. But how can we, moving forward, how can we actually use data, understand human behavior, and bring greater precision in the way we target our resources? So that's really the lens that we are taking in terms of
for people who don't know the foundation, I mean, there's this idea in business called customer obsession, right? And a lot of the most successful businesses, especially in retail and e-commerce, they are obsessed with their customers. They care about everything the customer thinks, and they want to understand why the customer thinks the way they do. Global development has historically not been organized that way. Something I write about in my book, that the business of changing the world, that we're in this moment of disruption. We're going from thinking about resources, handing out goods, giving money, to thinking about behavior and thinking of people as customers, really, no matter their economic status in the world. That is really what makes Surgo Foundation different, right? You're bringing customer obsession. I think it's on your website as a tagline, bringing customer obsession to global development. And now you're bringing it to COVID-19. But maybe we could just talk a bit about why that is such a big idea.
Sure. I think global development has been really effective in launching pretty large-scale programs and kind of spreading very wide. But at the end of the day, people on the ground are quite different. So not every service, not every intervention, not every message works for everyone, right? It's really important what is driving, let's say, a mother in village A versus a mother in village B in terms of her behaviors, whether it's, for example, maternal health services or not. So I think we've taken this one-size-fits-all approach, but we know that people are different. And so our perspective is that really understanding people and what's driving their choices and behaviors is really critical. Now take that to COVID. What's really interesting to me is that the intervention that we have right now, that is the one that is the most effective, is actually a behavioral intervention.
Social distancing.
Right, it is social distancing in the absence of the therapeutics and in the absence of the vaccines, the effective ones right now, what we're all doing is social distancing. But not everyone is social distancing. We know that from our friends and family, we know that from the media, right? So just telling people social distance, that's the right thing to do, is not enough. So the customer perspective here would be really understanding people, right? The differences between people, why they're social distancing or not, and then how can you target those messages? Similarly, you can also think about vulnerability, right? What makes a particular community more vulnerable than another community? And therefore, how should you direct your COVID resources accordingly, right? Not take a one-size-fits-all approach. So that's really the perspective we're bringing to this equation.
Yeah, you've got this great visualization, this map that overlays a number of data sets that shows what vulnerability is like. So not just where are there cases, but what about underlying health conditions? What about the strength of the health system? What about socioeconomic factors that might play into how deadly or how bad this virus could hit certain counties in the country? And you lay that out over the map of the United States. That's an interesting methodology. We'll put it up there in the comments so people can see it too, because that's an interesting thing to take a look at. I think what's different about the behavioral science approach that maybe not everybody always sees is it's multiple layers of analysis. So, one of the things we're hearing a lot about, I've even written about, is, well, in the developing world, where most of our audience here at Devex is working, much of the workforce is informal. So social distancing is obviously hard because they don't have a bank account and savings. They don't have an employer who can send them an email and say, stay home and work from home with your internet connection. So how do you address that? Well, often that's where the analysis stops. And I think what's different about behavioral science is, hey, let's go out and talk to those people and actually understand what are some really specific drivers in their lives. And maybe there's ways we can help them in a really specific way that gets to their direct needs.
Absolutely. I think you've described it really well, Raj. Yes, it is really trying to understand the specific needs of different types of people, and then taking a very nuanced approach in terms of how do you reach those people and what should be the messaging, right? So just telling everyone, stay at home is not going to work. But if you know that, for example, there's certain groups of families that are not staying at home because they really have to go out to get a living, then for them, the intervention has to be very different, right? Versus there could be a group of people for whom they just don't see it as they're at risk. And for them, the messaging has to be very different. So it's really understanding those nuances that is absolutely critical in terms of, doing this well and effectively.
So you're working on that. You got that behavioral science lens. You know a lot of the players who are involved in this at a global level. Do you see others taking that lens too? Do you think that we've sort of said, all right, social distancing is this blunt force tool we're going to use, and now let's put all our energy on vaccines and treatments? Or are others like you really trying to better understand the drivers of effective social distance? Is this becoming a bigger theme, or do you think there's under appreciation for it?
There are several researchers that are actually appreciating this point and are trying to understand it, and have put out several surveys. Some of those have not been actually public yet, the results. So I know that there are researchers around the world that are doing this. There was a really interesting article in The Economist actually a few days back on the UK and the UK's approach to social distancing and how to build that collective action. So for example, they were saying that the last time the Queen made, a public, speak was really something more around war, right? Whereas that the Queen came out and she talked, and that's kind of building that communal consensus. So I think the UK government is thinking in that way in terms of what are the different levers or nudges we can use, because social distancing in the UK is not enforced as a law. It's a policy, and it's up to people to do it or not, right? But they are thinking in creative ways, I think, in the UK as well, in terms of how to get people to social distance.
Well, in social distancing right now, it's taking somewhat different forms around the world, but right now it's largely about staying at home, right? That seems to be the message across most big geographies around the world: stay home. But soon we might be coming out of the stay-at-home phase, but still be in a social distancing world where we need to say, wear masks or wear face coverings of some kind, or yes, go to offices or restaurants, but you're gonna have to behave in a different way than you used to. I was just talking to somebody in Colombia yesterday, and they were explaining, it's a culture of hugging and saying hello in a very direct way. You got to learn to not do that. In the U.S., we shake hands a lot. How do you learn to unlearn or adjust those behaviors? That's not a small thing. What about that? What about those issues? Because this could be many months where we're going to need to do this sort of work. Do you see researchers and is your organization thinking about that phase into a different kind of social distancing?
Yeah, we are definitely, and I'm sure there are other organizations that that have the behavioral science lens are thinking about it as well. Yes, right now it's pretty simple, actually not so simple as well, right? Because when we started this whole social distancing practice, even the definition of social distancing was not very clear, right? It was first like, don't go to large gatherings. Then it was like, well, don't go to parties of more than 10 people. Then it was like, well, don't be 6 feet away from another person. So it became more and more nuanced. And I think that created a lot of confusion among people. And I think coming out of this, it's going to be even more nuanced and even more complex, right? What are the types of behaviors we can or we cannot do, or we should or we shouldn't do? It's going to be interesting, right? So are we in the US, as you said, move from handshaking to bowing, like in Japan, right? Is the handshaking going to disappear? But
what do you think? Do you think greetings like that, could you see kind of fundamental changes in the way people greet each other? Is that Is that possible? I mean, these are greetings that have been around for thousands of years, presumably.
I actually think it's possible. To be honest, even before when we started this social distancing, I remember having some meetings in my office with external people, and both of us didn't shake hands. There was an understanding that we shouldn't be shaking hands. So I think you'd be surprised. These things could change actually quite drastically, right? If there is a general consensus of that is not maybe a safe thing to do, or so we'll see. I think it's going to be a fascinating period in my mind.
Yeah, I mean, a lot of the reason why we went through what you just described, which is many changing rules around social distancing, was a lack of knowledge of this virus and how does it operate, how is it transmitted, and so we got more and more strict in a way. We went from, I think in France they said no gatherings of more than 5,000 people originally, and then it went way down, and then it was 10 here in the U.S. Then it's just stay home. So what that means in terms of human psychology, I'm curious to know from your perspective, because once the government says, well, yeah, you can go back, yes, offices are going to open and schools are going to open, presumably there's still going to be a lingering effect of, well, you just told me recently I can't even be within 6 feet of someone. So how do you think that's going to operate? Is there a chance we might need to almost reverse the behavioral science issues around social distancing to get people out?
Yes, there was an interesting recent Gallup poll, I think that just came out a day or two ago, and it said a majority of Americans actually, even if the country opened up, weren't feeling comfortable going back to normal life and just going back to normal social life. So I think it's going to take time. I think people will feel at risk, even if the government says now it's okay to go out. So I don't think the transition is going to be abrupt, as some people think. I think it's going to take time. It's going to go in phases. It's going to depend on the person. It's going to depend on the circumstance. So in some ways, yes, we will have to think about this from a behavioral science perspective as well, right? How do we get people to feel safe? How do we get them to feel that it is no longer risky for them to go out and socialize and go to work, even go to the supermarket, even go to a dinner party? So I think all of this is going to take time, and I think this discussion of opening up countries really needs to take that into account as well. I think there is perhaps, it seems like among leaders, we have to focus on the economy, which is absolutely important, and just opening up is going to mean people spilling back into the streets and going back to normal life. I don't think it's going to be that easy, to be honest.
Yeah, one of the worries I have related to that, I'm curious your take on it, is whether xenophobia is going to continue to rise. And we saw it already against Asian Americans, Chinese Americans, and others. Possibly we're going to see this virus spread in a lot of the developing countries and a lot of global South.
Yeah.
And it's possible you'll see countries, wealthier countries that get a handle on the disease, wanting to put up travel barriers and not bring them down. And that's obviously a huge risk for a lot of the economies around the world and for people's livelihoods. Is that part of a question around behavioral science? I mean, obviously government leadership is pretty important here, and that might be lacking in much of the world. How do you see that issue?
I mean, I've heard, for example, that even when governments open up, yes, they will put on travel barriers, and they may actually even put testing requirements for people coming from other countries to the United States. So that's going to be really interesting, and kind of putting this notion that the other is the cause, or the other can bring in disease, right? So going back to the early days of the pandemic, which started that way, and then all of us got affected, and as we come out of it, again, going back to that lens, well, we're fine, but the other could be bringing back this in, right? So I think it's a really important policy question, right? It's a global question for all of us. From a behavioral science perspective, I think we'll have to see how the policies play out and how populations react. But yes, I could see that xenophobic, lens still come in.
So what's tell me maybe a little bit more about specifically what Surgo is doing. I know you made this pivot toward it. What does it mean to pivot an entire organization? You're not a very large organization.
Yeah.
Maybe you can tell us a bit more about the organization, but what does it mean to actually pivot all of your work to this immediate crisis?
Yeah, I'll tell you a little bit how we got on this journey. So as COVID hit, we were like, okay, this is a really important issue. Let's spend a week brainstorming, right? Let's spend a week as a team, kind of an exercise, also feel like we're doing something about COVID. And let's brainstorm some ideas. And that week turned into over a month, and it's probably going to turn into months, if not possibly even a year or years, I think. So the pivot was for a couple of reasons. One is most of our work is global, right? It's in India and Africa, and some in the US. And knowing that COVID was coming, a lot of that work actually was slowing down, right? Because we knew that those governments were also pivoting their attention to COVID, rightly so. So for example, our staff in India couldn't, go to the field anymore. They couldn't travel anymore. So we saw these restrictions coming slowly and slowly. And then second, when we brainstormed, I think what we found is actually we came out with some very interesting ideas that we wanted to test and pursue. And those ideas really panned out. And so pivoting really meant now we're putting all of our resources into COVID. It doesn't mean that our other work is shut. It just means that it's kind of on hold for the many reasons I explained. But we will continue on COVID, and we will also go back to the other work. But I'll tell you a little bit about what is it that we've pivoted to. So one is actually we've been doing a lot in the US. So for those that don't know about Surgo's main focus has not been the US, although we have had some US programs. And so in the US, we were really interested in this idea of, well, COVID is going to enter every community, but not every community is going to be affected in the same way. And so we went out and saw, okay, are there indices out there that people have put out? And we couldn't find anything, to be honest. The one thing that we found was the CDC Social Vulnerability Index, which looked at a community's vulnerability to any disaster. And it had a lot of things that were not COVID specific. So we decided to develop this vulnerability index, which I can talk about more. Second is the social distancing behavior. Bringing a behavioral lens, we really wanted to understand social distancing. So in the US, we're taking kind of a big data approach, as well as going deep into understanding human behavior. We also have initiatives in Africa and Asia. In Africa, we're taking kind of a more frontline delivery approach, where we're looking at how do we actually do self-triaging in communities that have a harder time accessing health services, as well as perhaps don't have access to smartphones that can access some of those self-triage apps. So that's what we're testing as well in Africa. So yeah, we've completely pivoted, I would say, to COVID for the last month or so.
Yeah, and it's in a way a luxury, because I talked to a lot of international organizations. You are privately funded. That helps a lot. So presumably you got the private funders who support you to buy into this vision, and that helps. You're also relatively small. I forget how many people total you are at this point.
We're about 20 people.
You're about 20 people.
And 20,
that's easy, but it's a little bit easier than 2,000.
Yeah.
But a lot of the organizations I talk to are feeling a lot more stuck than that, because they're getting government funding and they're waiting for instructions about whether their existing projects are going to be stopped or they'll be changed into something that's more COVID-19 response related. You've got the ability to say, wait, we see an opportunity, we see something needs to be done, boom, we're going over there. And that's really exciting. And I think a lot of people probably watching this are going to be inspired by that opportunity, because something like this is really all about urgency. The timing is essential. You lose a day and the impact is enormous. So maybe we could just talk a little bit more what you're doing. You said something that makes sense to me, but I want to dig a little deeper. You said you use big data in the US. So okay, the US has a lot of data, unlike some of the other countries you're working in, where maybe the data sources aren't as reliable or as robust. You can use big data and do big analyses, but you said you're also doing some more targeted, deeper understanding of behavioral science. How do you do that? Are you doing focus groups? Are you doing what's the methodology to actually understand how people feel in the US about social distancing?
Right. So the one great thing about the US is that there are a lot of panels where you can actually tap into. So for example, NORC has a panel, Ipsos has a panel, Gallup has their own panels. So these are panels of US representative population that you can very quickly field surveys with, and these are surveys that are done online with those populations, and they're really
they pre-agreed to participate in surveys, and the demographics about each person. So yeah, those organizations have it kind of easily mapped out that it's a representative sample. Absolutely,
yeah. So those are people that have pre-agreed. We have a lot of information on those people that you don't have to ask in the survey. Again, their demographics, their socioeconomic, their jobs, their health conditions, who they voted for. I mean, you can get a lot of information on the respondents. And then they're also highly validated. So we know that those panels, they're being used for political polls, they're being used for health surveys. So they go through a rigorous check of validation that makes it a really reliable source of people to tap into. So that's what we used in the US. And that's why we actually designed the survey in 2 days, and we fielded it in 3 days. And we got the results back in a week, which is an unprecedented speed of getting survey results back, you know.
And I understand that those results are embargoed, so we can't talk about them here while we're live, but you and I are going to talk about this later. And so just a little teaser to everybody out there, we will be putting out a short video tomorrow that talks about the actual results from this survey once they're public. And that's something we're really interested to hear about. Maybe we could talk about self-triaging for a second, just maybe define what that means in the context in Asia and Africa that you were describing. What does it mean to self-triage when they don't have a smartphone and maybe the health systems are quite weak?
Right, exactly. So the whole concept of self-triaging is actually not to overwhelm the health system with people that, you know, are not necessarily have severe symptoms or don't necessarily have to go into a health facility, right? We have that here too. So for example, I'm getting messages from my health provider saying, answer these 5 questions, you know, they're asking you questions about your symptoms, etc. And then at the end, they tell you, if you have symptoms, depending on your symptoms, you're fine, stay home, you know, monitor, or no, go into the ER, right? Kind of that's the self-triaging. It's really determining who is okay to stay at home if they have symptoms and who should actually be going into a health facility. And that's really the whole purpose, is not to overwhelm the health system with people who don't need to be there. Now, in the context of Africa, while smartphone penetration is increasing by the day, about 50 to 60% of Africans still don't have smartphones. They're using your good old brick phone, right? So how do you do self-triage in that situation? So we're partnering with an organization which is still in the works, but I think it's going to be a really exciting partnership where we're going to be using a channel through brick phones, and we're working with medical doctors who are helping us develop that algorithm where people can call in, and depending on this, you know, they go through a series of questions, and at the end of those series of questions, they're going to be given a recommendation of whether, you know, you should go in or you should stay home, as well as a lot of information on COVID.
So this would be like press 3 if you have a dry cough or something like that. I mean, it's going to be that sort of a decision tree system.
Exactly. Yeah. It's still being designed. It's actually modeled after the COVID-19 check, which is another self-triaging algorithm, which is on smartphones, which is being also rolled out, but that's again targeting smartphone users. So really the idea is to be able to reach a segment of the population that's otherwise really hard to reach, you know, with smartphones. And the nice thing about this channel is that this is a channel that's already being used, and it's done in partnership with the ministries of health. They've actually are using it for general information on health, on agriculture, on whatever it may be. So we have actually a really big set of customers that are already using this service, and now it's just adding on a COVID.
I was about to ask about how do you scale something like this quickly, and that's obviously the way to do it, to go where people already are. That makes it so much easier. Scale and speed right now is an enormous challenge. How do you see this unfolding, COVID-19 itself, in the countries you're just describing, the places where Surgo normally works? You've got people on the ground in different places. You've got your finger on the pulse there. How do you see it moving?
Yeah, I think there's still quite a few unknowns about how this is going to play out in Africa, right? We know that, we know quite a bit about COVID, but COVID has really been in more developed countries, in high-income countries, which have a slightly different demographic and also have slightly different, I shouldn't say slightly, but quite different underlying health conditions or that are in the population.
Yeah,
so,
it almost seems like they weigh each other out. You've got much older people in Western Europe and in the US, much younger population in Africa, but then a lot of underlying health conditions too, in some places, depending on the country, but high HIV/AIDS populations, et cetera.
Exactly. So it's really hard to say and hard to know how those 2 factors are going to play out, because they may not necessarily be equal, right? So for example, an underlying HIV condition may have a much more exasperating effect on COVID, for example. We just don't know yet. So I think it's still early days. We do know that certain countries are actually are being very proactive in their response. South Africa, I think, is a really good example. We also, there's also kind of the dual point about some countries have had, HIV epidemics and therefore have certain systems in place, or other epidemics that, let's say, high-income countries don't have, right? So, an army of community health workers that are out there in the community that can do very quick contacts of, with households. In some countries, really good testing capacity because of the HIV epidemic, but in other countries, not so, right? And also the health infrastructure is generally weak, as well as the primary healthcare system. So I think it's going to be very interesting to see. I think that what we've learned so far from everything we've seen is act early, right? As early as possible, and act aggressively. So I think those are the two things we know for sure, and the two things that, hopefully a lot of countries are going to be doing.
Yeah, I guess the challenge, if you're a minister of health or you're a head of government in many of these places, is 80% of the population is working in the informal sector. So what does it mean to act aggressively? Probably if it means stay home, stay home messaging, but then people can't realistically stay home, or even when they do, they're in very cramped quarters. And then how long can they do that for? Because they got to go out and get food. And many of these governments are not really set up to do the kind of fiscal stimulus or quick funding directly to people through cell phones, et cetera, that you might be able to see in more advanced economies. So it seems like, while the narrative, at least seems to me, that the narrative so far has been very focused on the US and in Europe, China, the places where this is hit, particularly badly in the beginning. But very soon, this is going to be about the countries that we're talking about here. And we might find, in the same way there's a big debate about how late were governments to deal with this in the West. I thought, why are we so behind the 8 ball here in a lot of these countries? We knew it was coming. And what have we really done to prepare? I don't know, what is your take on that? How do you feel about where we are in terms of readiness for this? And do you think we'll see a wave? I mean, what's your own view about it?
Well, looking back, I think what we're seeing is the trajectory has been waves. And so I think if we look back, I think that the future says there are going to be waves. It is hard for me to really comment on Africa because I'm not in those countries right now, and I don't want to speak on their behalf. But social distancing is definitely going to be very hard. India is doing okay because it's become a national order, right? But it still has challenges of its migrant workers, right? Being kind of stuck and in the middle and not knowing where to go. So and as you said, in many places it's very crowded. What does social distancing mean? I'm in DC. I can order my food. How am I going to do it in a slum in Nairobi? So I think act early is really about increasing the testing, right? Testing, contact tracing, as if you can get that in very quickly, that would be really the best thing to do. But again, we have constraints there too with the testing availability.
Yeah, a lot of the people I've spoken to in these conversations are saying they think you'll see maybe the situation get a lot better in the US and in Europe in the summer, but then we'll have another wave perhaps in the fall, and that this could become a seasonal disease that is with us for quite a while. Do you have a similar take? Do you feel this is something that's likely to be seasonal and likely to be with us for quite a long time?
That is my expectation. I don't think we have data enough to support that yet. I think that is what we're expecting, but we'll have to see. I don't think we know enough about the virus and how it's going to behave as temperature changes. Is it going to mutate? Is it going to, get worse? But I think a lot of people are expecting that, and so that's why I think this is likely here to stay with us for some time, and it's likely going to impact the way we operate as human beings in society. It's going to impact how we go back to work. It's going to have an impact on many things. I don't think this is 2 months of staying at home and then going back to normal life. It's going to be here.
Yeah, I mean, it brings up all kinds of huge questions, obviously. But when you talk about behavioral change, in a way, the fact that this could be here for quite a long time means there's much more potential for real behavioral change, right? If this were a sudden event and we come back from it, it might be less significant in terms of how we change the way we work with each other and approach each other and the way we live.
Yeah, absolutely. And what kind of policies are people going to put in place in the government? Is everyone going to be tested multiple times? Are we going to have our antibody levels tested? What does it mean to be a carrier versus, negative for COVID, right? How is that going to play out? It's really interesting in my mind. And a lot of the behavioral side issues really depend on what are the interventions and the policies that the government is going to roll out, right?
Right.
That's what we're going to wait and see.
Yeah, what the social distancing has done, this whole idea of flatten the curve, is it's helped us to reduce the mortality rate. You know, still far too many people have died, but it's helped to reduce that somewhat. And so maybe if there are future waves, if this is with us for a long time, maybe we won't see high levels of mortality because we can have more of a handle on the situation. But having a handle on it will mean maybe things like offices not being at full capacity, people wearing masks, different ways of dealing with each other in terms of greetings, lots of changes in day-to-day life, potentially.
Absolutely. Absolutely. I mean, I don't see us, for example, as an organization going back to the office for some time. Even if the government were to loosen restrictions, I think we will probably take a little bit of a more cautious approach. So
when you say sometime, I mean, I don't want to make you predict too much, but do you think like this year you're going to go back to the office at all?
Well, we'll have to see how the epidemic plays out, right? We'll have to see. We're a very data-driven organization, so we'll see what the data says. But I don't see us going back next month or potentially even the month after. So we'll have to see. But even if we go back, what does it mean? Are we gonna?
I feel the same way. You know, Devex, we're 120 or 130 people around the world. A lot of it is going to be, you know, do people want to go back? You know, we can say we're opening our offices. Maybe the government says it first, then we as an organization say it second. But ultimately, people are going to vote with their feet. And if they feel like it's not safe, why would they go back to work? And if they can be productive at home, then maybe they'll continue to do that. So I agree with you. It's going to be potentially quite a long process.
Yeah, absolutely. So the data says something quite interesting, actually. So going back to the big data stuff in the US, we've taken this vulnerability index, which we mapped to the very micro level. On top of that, we mapped the COVID case data. But on top of that, we mapped social distancing data. So we have real-time data on who's social distancing and how much and where. Who, I don't mean at an individual level, but at a community level. And one of the things we've seen when we look at the pattern is that actually in many places, people started social distancing even before the government policies were put in place. So, and we know, right, a lot of private companies actually did stay-at-home orders much sooner than the government policies. So I think it's going to be very interesting. As you said, people are going to vote with their feet. People are going to make their own decisions. It's going to be a lot about how risky is it for me, or do I feel it is for me and my family, right? For example, I live with my mother right now. She was visiting now. She's stuck with me, but she's over 80, right? So I've completely modified my behavior because of her, right? I rarely go out and go to the supermarket because I'm concerned for her, not so much for me. It's going to be quite interesting to see how people are going to make their own decisions based on kind of their own situations and their own perceptions. I think risk perception is a big one.
Risk perception is huge, and it gets to another one. I'm asking you to speculate, but it's just interesting to hear, given your position. You know, our industry, global development, is very centered around travel.
Yeah.
A lot of the people I'm speaking with, that this is one of the first things they want to talk about, because it's really hard to operate in the way we've operated before. This is, you're in global health. People go to many conferences during the year, and that's one of the key ways they get information and interact with their colleagues, whether it's scientific and academic levels or policy levels. People travel to the field. They have to go and see projects. How do you expect that's going to evolve in our own sector?
Yeah, it's definitely going to change. I think there are going to be some positive changes too, in my opinion, right? Perhaps we will be a little bit more thoughtful in terms of whether we need to actually, travel to this destination for that meeting, right? I'm not saying travel to the field. I think travel to the field is really important, but I think a lot of us travel a bit too much, right? And maybe we're going to be a little bit more conscientious about it. We also are seeing we're all operating on Zoom. Or on some other platform, right? Teams, whatever it may be. It's actually working, right? We can make it work. So I think it will have, in my mind, a positive impact in the sense that, we will be a little bit more thoughtful in terms of what is it that we should be doing in terms of travel and what is absolutely not necessary, and saving money, to be honest, and using that money in other ways.
Yeah, I mean, one of the ways we might need to use that money, I think the global development community can sort of witness the growth of connectivity in the global South, but hasn't really led it. And this doesn't work, or it maybe even exacerbates the divide if you don't have high bandwidth connectivity, even in rural global South countries, right? And there are tech companies working on this, there are mobile telephony companies working on this, but we can't do our work if we don't have access through these kinds of platforms everywhere.
Right.
And already the global conferences were, quite limiting because people with money can fly to Geneva, but there was some representation. You might see some budget set aside for people to come from countries with lower resources, but this connectivity issue is going to be really critical if we are to move to a different model of doing our work.
Yeah, that's absolutely right. And I think we'll have to solve that. I'm not sure it's going to be you and me that's going to solve the connectivity issue, but hopefully governments and other companies that have the bandwidth and are working on this are going to be incentivized to take, faster action.
Yeah, absolutely.
The one other thing I wanted to say is I actually do think it's going to have really, in my mind, positive repercussions on the way we look at health and the delivery of health. In the US especially, but I also think in other countries, moving to and leveraging better mobile systems and telehealth and, direct to customer approaches of, healthcare. So I'm very excited actually about the innovation, the potential for innovation in that space, because now there is actually a need and a push. And also governments are, easing the regulatory, landscape for these kinds of interventions and models and companies. And so I'm quite excited about that as well.
Yeah, there could be some silver lining. There could be some good things that come out of this. And it's important to think of those now, because otherwise, obviously, it's such a bleak situation. We need to be focused on how we can turn this into some positives for many people in the world who were suffering well before this pandemic, right? And that's obviously the work that you and your great organization do every day. So let me just say a big thank you for joining, for sharing all those insights. Really appreciate that. We're always following you and your work. You're right at the cutting edge of so many issues. So it's exciting to hear how you think about these things. Be well, be safe. We'll talk again soon. Thanks to everyone who's joined this live and those who will watch it later. And feel free to find Sema and myself on Twitter. Let us know if there's other things you want to hear about. We'll have to answer those questions online.
Great. Thank you so much, Raj. It was a pleasure.